Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone, today we're going to talk about Rosuvastatin. This medication is very important for people who have cholesterol problems. So, let's learn how and when to use it the right way. Rosuvastatin is a medicine that doctors often prescribe to treat high cholesterol and prevent heart disease. If you've had heart attacks, strokes, or blocked arteries, your doctor may recommend Rosuvastatin. And how does it work? Rosuvastatin belongs to a group of medicines called statins. What it does is block an enzyme in the liver that is needed to produce cholesterol. In this way, it helps lower bad cholesterol, LDL, and raise good cholesterol, HDL. As for the dose and how to take it, it is super important that you follow your doctor's instructions to the letter. Normally, you start with a low dose, like 5 or 10 milligrams a day. Depending on how you are doing, the doctor may adjust your dose. The important thing is to always take it at the same time, whether with or without food. Like all medicines, Rosuvastatin can have some side effects. The most common are muscle pain, nausea, and headache. If you notice more serious side effects, such as liver or muscle problems, contact your doctor as soon as possible. And it is also important to bear in mind that it should not be used during pregnancy or breastfeeding. In short, Rosuvastatin can be a very useful tool for controlling cholesterol and protecting your heart. Remember that you should always consult with your doctor before starting any treatment and follow their instructions carefully. I hope this information has been useful to you. Take good care of yourself, and see you next time.
If you've made it this far, let us know in the comments why you're using this medicine.